Thank you. Good evening, and thank you everybody for joining our Community Leaders Call. We're going to get started here in just a moment, and today you'll hear from our Director of the D.C. Department of Health, our Director of Homeland Security, and our Director of Employment Services, but we're going to get started here in just a moment. So again, if you could just hold just a second, we'll get started here shortly. I want to remind everybody that is joining us that you can get the most up-to-date information and resources at coronavirus.dc.gov. And then if you have any questions, we'll go, when we get to the Q&A section, you can press 0 now if you already have a question, or you can wait until we get to the Q&A section to press 0 to get entered into our question queue to ask your questions. So again, we want to thank you so much for joining us, and we'll get started here shortly. Good evening, everyone, and thank you for joining us. My name is Tomas Telmont, and I am Deputy Chief of Staff to Mayor Muriel Bowser. We want to thank you for joining us for this evening's Community Leader Call. Today, we have with us Dr. LaQuandra Nesbitt, our Director of the D.C. Department of Health, Director Christopher Rodriguez, who's our Director of the Department of Homeland Security and Emergency Management, and then we also have Director Unique Morris Hughes, who is our Director of the Office of Employment Services. I'm going to go through a few updates with you all, and then I'm going to go to Director Morris Hughes, who this morning at our press conference announced a few updates related to unemployment insurance, and then we will move to question and answer to answer any of your questions that you may have. Again, if you have any questions, you can press 0 to get entered into the question queue. But again, we want to thank you for joining us for the call. As of today, we have reported 108 new cases of COVID-19 in the district, bringing our total cases to 3,206. And sadly, we also announced 15 new deaths, bringing our total loss of life to 127 Washingtonians. What these numbers tell us is while we've made good progress, we still have a lot of work to do together to flatten the curve. And so we want to thank you for those on the line and our residents across the district for staying home. We need you to continue to stay home. Only leave the house for essential activities, and when you're out, to ensure that you're practicing social distancing, wearing a face covering, whether you're going into a store, whether you're going out to do an essential errand, and or conduct other essential business. One area that we're particularly focused on is increasing our testing capacity, and the mayor highlighted additional testing sites coming online, including a testing site at UDC, the Bertie Baucus campus. And so we are particularly focused on increasing that capacity. To protect our most vulnerable populations, we're deploying new rapid point-of-care instruments to our congregate care settings. As I said, we had opened a new testing site at UDC Bertie Baucus in Ward 5. This site will be open on Tuesdays and Thursdays and will be a walk-through and a drive-through testing site. And residents that need to schedule an appointment, you can do that by calling our hotline at 1-855-363-0333. Again, that number is 1-855-363-0333. Going forward, some asymptomatic individuals who have a history of exposure exposure and are in high-risk groups such as healthcare workers or hospitalized patients will be prioritized for testing. So again, some asymptomatic individuals again, who have a history or exposure and are in high-risk groups, such as healthcare workers and hospitalized patients, will be prioritized for testing. And we have additional information about those priority testing groups on coronavirus.dc.gov under testing. We also have all of our testing sites posted online there at coronavirus.dc.gov/testing, where you can see the full list of locations, additional information on testing, and our numbers to be able to make appointments for testing. This data and information through expanding testing will be vital as we work to eventually reopen parts of our city and our economy. But to get there, we know we need to see a sustained 2-week reduction in new infections. And until that happens, we're going to keep working to support our residents who've become unemployed during this crisis. And so, today, Director Morris Hughes joined the mayor to announce a few of these new items related to DOES. So, Director Morris Hughes, do you want to give a quick update on some of the announcements from this morning?
Sure. Thank you so much for having me. And I'll provide a brief economic relief update specifically to unemployment insurance. And so first, I just want to highlight for folks where we're at today in terms of unemployment insurance. From March 13th to April 21st, over 72,000 individuals have filed for unemployment, of which almost 34,000 individuals have received payment to date. From March 13th to April 21st, we've paid out over $90 million in benefits. Additionally, to support our unemployment insurance operations, we are almost near 190 individuals that are staffing our call center. This includes DOES staff, two contract call centers, and then our sister agencies that have partnered with us to stand up an additional call center operation. We have also launched a virtual assistant who has received over 100,000 hits that are on our website, where individuals can ask questions that are what we consider to be Tier 1 questions. We, in addition to adding additional human resources and additional technology, we've made several updates to our unemployment insurance system. We're grateful for everyone who has been patient as we make the system updates. I always remind folks that it's just over a month, and we're still getting trickle-down guidance from the federal government on how to run and implement these programs. And as we receive it, we are expeditiously making updates. We are launching 2 additional programs this week. We launched earlier this week the Shared Work Program. And the Shared Work Program is a condition of the CARES Act, and it allows employers to reduce the number of hours of individuals they have on staff, and allow those individuals to receive unemployment insurance benefits. There is an application, there are one-pagers, and a program guide on the Shared Work Program on the DOES.dc.gov website. And then the last update I'd like to provide is the Pandemic Unemployment Assistance Program. This is a derivative of the Unemployment Insurance Program, where you can receive unemployment insurance benefits plus the additional $600 a week for freelancers, independent contractors, gig workers, and self-employed individuals. We will release this application at the end of the week, and this is a great way to get economic relief if you do not qualify for unemployment insurance benefits. I'm happy to take any questions, and Tomas, I'd like to turn it back over to you.
Thank you so much, Director, and just want to extend a big thank you to you and your team who have been working very hard to help to get our systems in place to help our unemployed residents during this crisis. So we just want to thank you for that. Again, if you have any questions, please press 0 now. we'll move into the Q&A portion of the call. So we will first go to Martika Blackson. Your line is unmuted in Ward 7. Martika? So she, not knowing her question specifically, I think there's some specificity that we would need with this question, but I think the question is getting at is how long is usually the period from application to receiving your first payment, Director Morris-Hughes?
So we typically are able to adjudicate a claim within 21 days for straightforward, less complicated applications. If an individual has a more complicated application due to the surge in volume of applications, it could take a bit longer. We do, however, strive to process claims within 14 days, and many of our claims are adjudicated and paid out within 14 days.
Thank you, Director. Again, I want to remind everyone, if you have a question, you can press 0 now to be entered into our question queue. We're next going to go to Frank Frank Finnemore. Frank, your line is unmuted.
Thank you for taking my call. I have 2 quick questions. The first is on the number of ventilators. We went from 405 to now I think we have 444, so that's 39 additional ones. I know California was reported to give us 50, so I don't know if we've seen all of those yet and if more are on the way. And also, I remember seeing that $15 million was used to procure additional ventilators and PPE, but no numbers were given and no timeline. So I'm interested in that first. My second question is if the D.C. government would consider a mailing to seniors who are experiencing social isolation and may not have internet access or other cable means to get the latest information. I'm worried that those seniors are being left out.
Thank you for those questions. And I'll take your second question first. We have definitely been doing mailers to seniors across the district to ensure, because of knowing that technology, there may be a technological gap there. So we have done thus far 3 mailers, one that's actually hitting seniors' mailbox this week, focus on symptoms, different resources available to seniors at this time, but then also testing information. And so we, the mailer that is coming into seniors' mailboxes this week is focused on the testing map and the different locations and information on how to get tested as a high-risk population. And so that is hitting mailboxes across the district, and we'll continue to do those mailers to ensure that we're getting out information, as well as robo-dials and other means to communicate with our senior population. So I'll pass it to Director Rodriguez for your first question.
Yes, thank you for the question on the ventilators. We have received the 50 ventilators from the state of California. We received them about a week and a half ago. And FEMA just this week agreed to supply us with 150 additional ventilators, which are now in our warehouse. In terms of our ordering, the mayor has directed us to be very forward-leaning and lean into purchasing, first of all, locating and then purchasing ventilators. So we're looking to source an additional 350 ventilators, and those are on order as we speak.
Thank you, Director. We'll go to our next question from David Bardeen. David, your line is unmuted.
Hi. I wanted to throw out the question whether the district should consider a pilot project together with Maryland and Virginia on using sewage and the coronavirus that can be measured in the sewage using genome information to see whether we're getting better, our situation is better or worse, and to get an early warning if, as we come to the cold weather again, whether it ticks up again. I had a conversation this morning with Maryland's Secretary of the Environment, Ben Grumbles, and with Cliff Mitchell, Dr. Mitchell is in the Health Department of Maryland. He directs the Bureau of Public Health. And I think that there was an interest, but that's particularly on his part. There's a model. The government of Australia's science agency did conduct such a proof of concept pilot project, and they put out a blog. They posted a blog on April 17th, and they've decided to go nationwide and implement such an additional source of information. Now, that's an additional to the testing and all the good reports we just heard about the additional testing sites, and it's additional to everything else. I think that might be a tool for Mayor Bowser and the two governors to be able to keep track of what is the situation in our population. It wouldn't help deal with individuals. It would be more a community assessment. So I wonder what's the reaction.
Yeah, David, thank you for that. I'm going to pass it to Director Rodriguez to chat about that.
Thank you, David, for that suggestion. The mayor is in regular contact with the two governors, and we will certainly take your considerations and suggestions under advisement. So thank you for that. Thank you for that suggestion.
All right. Again, if you have any questions, you can press 0 now to get entered into our question queue, and we will we'll address those. Again, want to remind residents as we wait for additional questions that come in, coronavirus.dc.gov. A little scheduling note for everyone on the call. We usually have our press conferences daily at 11 a.m. Tomorrow's press conference will be a little earlier at 10:45 a.m. So please make sure that as you tune in, we'll be starting a bit earlier at 10:45 a.m. to go through our updates, our daily updates. That is broadcast on Channel 16 as well as mayor.dc.gov/live, and then all of the mayor's social media platforms. So any other questions? Looks like we got through all the questions today in record speed. Well, thank you all again so much for being on. We appreciate you joining us every Wednesday to get your questions answered and get up-to-date information from the administration. Again, we hope you'll join us for the daily press conferences, usually at 11 a.m. Tomorrow's will be at 10:45 a.m. We appreciate you helping to spread information out to your fellow residents. We do have the testing sites, all of the new testing sites, including the UDC Bertie Backus campus site in Ward 5. That is all on our website, so we hope that you will share the map on your social media platforms, get the word out on the phone numbers that people can reach and to dial to schedule an appointment. We also have the UMC testing site as well, and then additional sites throughout the district, and so that full map is online. We hope you will share it on all your social media platforms and help us spread the word. I want to thank all of our directors for joining us. Thank you all so much for being on the call, and again, coronavirus.dc.gov for the most up-to-date information. Thank you.